All right, welcome everyone. I am Cassandra Wallace with ThedaCare Public Relations. I'm joined by Dr. Zach Baeseman, who is a family medicine physician in Wild Rose, Wapaka area. Dr. Baeseman, you are heavily connected to the rural areas, if you will. Can you, first of all, I just want to know a little bit about your background before we jump into our myths and misinformation section.
Yeah, sounds great. Thanks for sponsoring this event. I think it's so critical that we get information out to our local communities. I think in the whole national scene we have right now, our media outlets are not serving our local areas really well. My background is in family medicine. I took a master's of public health and a medical doctorate degree from the University of Wisconsin School of Medicine and Public Health. And then I did residency in Appleton, Wisconsin, trained as a family physician, and took a brief year to go out to Seattle to get some surgical training so that I can do C-sections as a family doc in a rural location.
Perfect. And like you said, you had a busy morning, and that's sort of what it is with, a rural family medicine physician, right?
Rural family medicine is never boring. Every day is different. So we've had a little bit of everything already this morning and kind of an exciting day. So.
Wonderful. Okay, Dr. Baeseman, we are here today to really talk about COVID-19, what we're seeing in the rural areas specifically, the Wapaka, the Wild Rose, the Waushara County areas there. Let's start off a little bit by talking about what we're seeing in those areas right now and in the state of Wisconsin. What are the numbers looking like?
Sure. So the numbers you can easily access through the Department of Health and Human Services with Wisconsin. It's a great reference to be able to actively track what's going on in your local counties. Currently, to date, Wisconsin has 23,000 positive cases of COVID-19, and there have been nearly 700 deaths statewide. For our data, the latest data as of today, in Wapaka County, there's been 79 cases. We've tested almost 4,000 people in the county, 3,875. There's been 3 deaths thus far. And it's important to note 1 week ago today, our caseload jumped in Wapaka County from 66 cases to 77. So we did have kind of our first outbreak locally. It has been kind of contained. Luckily, we've had some great people on the ground that identified it early on. But those are going to be things that become more common as we start going into the pandemic, is smaller outbreaks with groups of people or people that live together that are exposing each other. In Waushara County, it's less populated. We've had so far 16 positive cases in Waushara County. There's been almost 2,000 people tested thus far, and there's been no deaths to date. So that's good. That's kind of what we're seeing in our 2 counties geographically. We're also seeing in the state. A lot of the media that we're seeing right now is talking about, is there a potential second wave happening? And I think a lot of that language is a little bit confusing because on the coast, there may indeed be a second wave potentially as they kind of went through their initial surge. In the Midwest, and specifically Wisconsin, we have a very, very different scenario. And part of the reason why we have a different scenario is because we had at least 2 to 4 weeks lead time on the coast as this was being identified. The coasts were trying to literally figure out what was going on real time while dealing with a surge. And we've had a lot more time to prepare. And so we had a really rigorous and robust public health response early on. And despite the economic challenges with having such a robust public health response, it really shut down our first wave to a large extent. And so, I think the language is probably more appropriate as we're still holding off our first wave. And that's partly why we want to get into a really great community discussion about what we need to do to be safe and how we're getting information that is potentially misleading to community members. I would say, just generally speaking, there's 2 trends that I observe in our own community that are really leading to this. And I think these trends probably hold true nationally. One of them is that the media is just lightning speed. The whole age of Twitter is something very different than we've ever had to contend with before in modern or even human history, for that matter. So unfortunately, sound bites and interviews happen and things get leaked out and covered by the media, which has a 24-hour news cycle, and they're trying to sell you news. That's part of their job. And that gets ahead of the science, and that's really dangerous because it creates a situation where they have to occasionally walk back pieces of information because the science doesn't sustain or support some claims that have leaked out to the media too quickly. And it creates a situation where community members are stuck in this spot where, can I trust what I'm hearing or not? And that's a big problem because in a pandemic, the most important thing is that we have consistent communication. And the situation, as you've heard, is fluid, it's dynamic, it's changing quickly. It can change quickly. It has changed quickly in the last several months of dealing with this. And so it's really important to have sources of information that you trust, that you can really be prepared for what you need to know. The other really common thing, and patients have been, approaching me with videos of stuff that's just really bogus. A lot of conspiracy type videos that are really trying to propagate misinformation. And to what gain, I have no idea. But that's a really big contributor to people potentially having misinformation and confusion. There was the doctor video that was out, I think last month or so, with a couple of docs that had no expertise in public health. And they were posing as experts, telling information, saying this is really close to influenza, it's not a big deal. It's a narrative that you've heard out in our popular culture, and the narrative is just totally false. It's not even comparable, and that creates a different kind of dangerous situation where people have a little bit of information and they make big assumptions about what they think they know or don't know about COVID-19. And that can lead to people taking extreme measures, having too much fear. And that can also lead to the opposite of people being really cavalier and treating this as if it's not real. One of the things in Wisconsin that I think is just so critical is that because we've had such a robust public health response with the stay-at-home order for an entire month or more, because we've had the lead time, it's really easy to get yourself into the trap of thinking it's not here and it's not a big deal because we're not seeing what was seen in New York and some of the other scary situations with surges. But I can tell you, it still is here. It's still coming. And one of the other ways that we're seeing pretty commonly being reported in the media that's misleading is the percent positive cases. And I wish they would truthfully stop reporting the statistic. It's an important statistic, no doubt. It's a very important statistic, and it is part of what was the Badger Bounce Back program that epidemiologists and experts had put together. But right now, at our current snapshot in time, we are expanding testing. So as healthcare systems are trying to recover from the economic crisis that we all have with shutting down, we're trying to get back to normally practicing medicine and getting people the essential cares that they need. And we're testing a lot more people. We're testing people before they have surgeries or procedures. We're testing all OB patients every time they interact with labor and delivery because we know that they're more likely to be asymptomatic carriers. And so as the testing goes up, the percentage positive cases drops. It's just a math thing. And this is the problem with statistics, is that you can paint a picture that may not be accurate, whereas the absolute case numbers day to day have been the same or increasing. So it's misleading to say that this is going away. That is absolutely not the case. And that's why we're here talking about all these different things. So
yep,
thanks for
thank
joining
you
in.
for, yeah, Dr. Baeseman, that is perfect. That is a great explanation of why we are doing this Facebook Live today, why you brought this idea to the table. So that's really what we want. We're asking the people who are watching to engage. This is your opportunity to ask those questions. You have Dr. Baseman's ear. Go for it. Ask the questions. Are you hearing myths or misinformation? Are there questions you just want to know that you might not feel that you're getting the correct answers to? You have someone right here with the public health expertise, the medical background. So we want the audience to engage, ask those questions. We will be taking the questions live. So I am monitoring Facebook right now. We already have some questions coming in. So be patient as we're trying to get to everybody. I promise we absolutely will. We have some questions, Dr. Baeseman, here about, this is a really great one, I feel like, for your area. Gail wants to know, what safety measures would you recommend for boaters on the chain?
I think that's a great question, because summer is here and people are literally going stir crazy staying at home. They need to get outside. You need to get outside for your health. That's a critical thing. You have to get exercise. You have to get some aspect of whatever the new normal of socialization is so that you can stay connected to people. Generally speaking, one of the good things about this is it's not spread through water. So if you're swimming, there isn't real concern of it spreading, being in the same, swimming area or recreational, water kind of thing through the water. It's spread through droplets. So breathing, coughing, those kinds of things is how it's spread. So the nice thing about boating or doing something like that recreationally is that it's probably a really pretty reasonable and safe activity, provided you can maintain social distancing. So social distancing is really important. There's nothing magic about 6 feet. It's all about managing risk. So the general recommendation is 6 feet, but more feet is better than 6 feet. And wearing a mask is better than no mask. And doing all of those things can really help reduce your risk. So, generally speaking, if you're going out boating, one thing that I would think about is closed loop risk. So, with your immediate family members, you're obviously sharing risk. You're in the same communal area, you're living together. Your risk is pretty much the same. If someone catches it, you're probably all going to catch it. So if you can manage your activities by having those closed loops of risk, that would be ideal. So if you're going to go boating with your family members that you're already sharing risk. If you're going to go boating with other friends, then it really requires a conversation about what is your risk, what is our risk, what are you doing, what are we doing, and is it worth potentially sharing our risk for what it's worth. And with that comes, really the important social pact to say, if any of us get symptoms, we have an obligation to communicate that to everybody involved and shut it down and quarantine ourselves so that we aren't spreading this accidentally to other people in our community.
I think that's a really great point that you make as we maybe do expand our social circles from just our, family at home. Those conversations are extremely important. I think it's important to be open and honest, like you said. Are these difficult conversations sometimes?
They can be very difficult, and it depends upon, what information people have, and, to some extent, are they taking this seriously and taking precautions, or are they really wishing or pretending that this isn't going to happen or that it's not as big of a deal as it actually is? I mean, this is a 1 in 100 year pandemic. This is something that most of the living people around have never experienced before. And so it's so important to be guided by good information in making these decisions. So yeah, it can be really hard conversations. I know that we've had some hard conversations with some of our family members about, what are we willing to do? What are we not willing to do? And it's challenging, especially for folks that potentially, you know, may not see their loved ones again. That happens. That's happening right now. I mean, I have some patients that are elderly, don't know how long their life will be, and the prospects of 12 to 18 months of not seeing their great grandchildren and their grandchildren is is a lot for them to even wrap their head around. And in some of those situations, it comes down to informed consent. It comes down to everybody having the same information. And for some of my patients that are really potentially in an end of life situation in the next year, year and a half, it might make more sense for them to have their family tighten up their risk and share that risk so that they can actually see and hug their loved ones. And do I recommend that for everyone? No. Do I recommend it for some people? Yeah, it might make sense because for some people, the aspect of quality of life may not be as high, not having contact with those really important people in their life. And the prospect of time over quality may not be as important to some folks. And so those are really challenging. They're all individualized and they're all really challenging scenarios. And the one person that can help you all out a tremendous amount is your primary care physician. The frontline healthcare workers have literally gone back to medical school, learning everything they possibly can about this brand new virus. I mean, literally the reading that all of the frontline workers are doing and learning so that we can be prepared to take care of you, to advise you, to make sure that we can help you navigate through some of these tough decisions that aren't going to go away tomorrow. They aren't going to go away in the next couple of months. This is the reality that we're looking at. And from my perspective, someone who's in the work, who's learning this information and applying it every day, has a little bit different perspective. And I won't say more important, but I'll say a unique perspective that is very valuable compared to a media doctor who no longer practices medicine and is basically, a pundit on a national, news 24-hour cycle. Not that that doesn't have, some value potentially too, but it's very different when you're talking about a person that has skin in the game. It's my safety as well when we're talking about COVID, working as a frontline worker, as is all of my colleagues and all of the staff you would encounter, in the hospital system. We're really an underutilized resource right now.
Right. Having those conversations, like you said, with your primary care provider, a trusted source that, has that reliable information, extremely, extremely valuable. Again, sort of what we're doing today, people have your ear. We welcome questions. We have a lot of them coming in right now. Let's get to a couple of them. Linda and Debbie both have questions about masks. They're asking, there's been a lot of information about, do I wear a mask? Do I not wear a mask? So Dr. Baeseman, what is your take? I know you feel probably pretty strongly about this one.
Yeah, a mask is super helpful, and it's about managing your risk. So do I wear a mask every time I leave my home? No. If I'm going out to the woods to mountain bike, or if I'm going to go on a walk by myself or a run by myself, I'm not going to have contact with people. You can safely do those things if you aren't going to have exposure to people. But if you're going to be in a community area where there's a lot of foot traffic, a lot of people coming and going, there is absolutely benefit to wearing a mask. And there has been some confusion about this as well. The mask doesn't do as much to protect me as it does to protect my spread of this disease to you, because the respiratory droplets coming out of my mouth as I'm talking get knocked down with a mask. And so they aren't necessarily spreading that 6 feet or 20 or 30 feet if you're sneezing. So that's part of it. So, I think about wearing a mask as my duty as a citizen to my fellow citizens. And, also to protect myself and not catch this as well. So a mask is critical. And a cloth mask is not as good as a surgical mask, but it is definitely still valuable and is worth wearing. When we talk about the whole pandemic, way back in March, the conversation was potentially about using cloth masks for medical professionals because we didn't have supplies. And that to me is just, that's scary. That's really scary stuff. This is people that are frontline workers. So, but now as we've had the time to really prepare with personal protective equipment and testing, which we didn't have. So the whole, was it worth it if we all catch it? Yes, it was worth it because now that everything has been reversed. So was it worth it to do all these harsh types of public health interventions? It has given us at least a fighting chance to be on the front line and not get sick ourselves as we're trying to care for our community. So it's made a tremendous difference. And the evidence is pretty clear. A cloth mask is definitely helpful when you're out and about. I wish that more of our businesses would be on board with this, especially with protecting their own workers. Grocery store, in gas stations, I've seen some of the plexiglass. That's helpful, especially if the workers are going to be behind it and they're sanitizing their hands. Washing hands is really important. Some of the glove recommendations out there, are a double-edged sword. I see a lot of patients initially that were coming in with gloves and, they're touching everything, including their face with their gloves. Well, that's not useful. Your hands and skin are a fantastic barrier against viruses. It's just a matter of not touching your face and washing them for at least 20 seconds with soap and water, happy birthday, 2 rounds, or some kind of hand sanitizer gel.
Okay, perfect. Great. I'm glad that we could get to Linda and Debbie's question. Again, a lot of questions coming in. We're trying to get to as many as we can. We have one from Adrian who's asking, can you get COVID-19 twice? Which I've seen a lot of that same type of question. So if you have been tested positive, can you get it again?
This is the really nuanced part of that also gets into the whole aspect of vaccinations, is that, right now, we don't know how much immunity you get by fighting this thing off. You get some, no doubt, you get some immunity, but how long does that last is really difficult to understand right now because it is new. So when you look at childhood vaccinations, these are studied intensely, and they have a specific schedule of this period of time, this period of time, this period of time, because that's how many shots on that timeline we can best protect those people from those diseases and on average give them lifelong immunity. So when a vaccination comes out, I don't know if it will be a series of one or a series of two or a series of multiples. That's part of it that we just don't understand yet. And there are currently lots of work going around. There's to some extent like 100 different vaccinations that are currently being worked on worldwide. I know one of them has made it through phase 1 trials. Phase 1 trials don't do anything at all to look at whether this thing works. Phase 1 trials are really looking at side effects. Do people tolerate it? Is it safe? So it's a process, unfortunately. There was something else about that question, Cassandra.
Catching it twice if you're
Catching it
testing
twice.
positive. Yeah.
So this is the aspect of it that, is hard to understand. There is documented literature in case studies that people, healthcare workers, have gotten it, and they have gotten it twice. And I would say the leading thoughts about this is it's about exposure. And these were folks that were taking a lot of exposure, potentially not with appropriate PPE, tremendous amounts of exposure. And, obviously that potentially could play into whether it can overwhelm your immune system, even if you have some partial immunity. So, the short answer is we don't know. It can happen. But the whole idea with the vaccination is to find that sweet spot to be able to get people lifelong immunity or enough immunity to get through whatever the season phase of the virus is.
Okay, good points there. Like I said, we're getting a lot of questions in. Rebecca wants to know if we can go back after our Facebook Lives ends if we don't get to everyone's question. And yes, we will. Again, leave your questions even after the Facebook Live ends. We will try to get back to those and get maybe Dr. Baeseman to answer a couple questions. Maybe I can send you an email, Dr. Baeseman, from a few that we're seeing. But yes, we will do our best to get to everyone's comments even after this live session ends. Barb wants to know, looks like she's heard that you might become sicker if you wear a mask. Seems like a type of maybe myth or misinformation that you're hearing. Can you address that for us?
It's really interesting because this concept has come up on, in what's the best way to say this? Multiple populations that really have very different ideologies. So this is a theme that's coming out on the periphery of our society as a whole. And it really is bogus. You can have asthma, you can wear a mask, that's fine. There isn't any problem with that. People who have asthma who are going to be active in the winter wear a respirator so that they can humidify the air. So it's not really a problem with wearing a mask, generally speaking, for the vast majority of folks. The thing that I've heard people say is that they're concerned that your carbon dioxide level will increase if you have a mask on covering your face because you're rebreathing your own carbon dioxide. And the masks are incredibly porous. So this is not in any way something that is even probably measurable in a healthy person with a standard surgical mask or cloth mask. Now, the one group of people that I would say we have to be careful with, just in general, is someone who has chronic obstructive pulmonary disease, is on oxygen, and is a known CO2 retainer. And that probably goes above what most people even want to talk about or learn about today with this call. But those folks can retain CO2 by default because their lungs aren't working well enough. And those people could get into a potentially situation where they could be retaining more. Now, that being said, that individual is at incredibly high risk for dying of COVID. I mean, the mortality for that patient, we're talking, especially if they're over the age of 60, we're talking 20, 30%, pretty reasonably as far as a mortality rate catching COVID. So that's an individual that I wouldn't expect to be wearing a mask and out in public very often. Social distancing, staying at home would be the safest option for somebody like that.
Okay, so good to know. There may be some specific health reasons that may influence that, but in general, no, you would not have any other issues that may come up if you are wearing a mask. You wouldn't get sicker.
Correct. Yeah.
Okay,
Correct.
good to know. So again, lots of questions coming in here. Taylor is asking a question that I think many of us are probably asking in the back of our minds. How long do you foresee social distancing lasting?
I think the real question is whether this becomes a permanent structure of our culture as far as how we think about viral spread of illnesses. There's nothing with the pandemic that's going to be done sooner than a vaccination, and that's a really sobering thing to wrap your head around, because a vaccination in the fastest scenario is looking at probably at least 16 months from now, 18 months from when we started it. And keep in mind, this is a record pace in human history to come up with a vaccination. I mean, this is really, people are literally innovating and figuring this out live as we're dealing with this. So, that also lends itself to some setbacks that potentially could come about. So, we're looking at least another 16 months of pandemic if we get the vaccination, and then it has to be ramped up, and the logistics of ramping this up to scale on a population level for 1 million doses is a whole nother set of logistics that is daunting, to say the least. So I think the social distancing should be part of our lives until we have that, until we are safer in that regard. It is truthfully going to be the new normal going forward for quite some time.
Okay, that's good for us to know. Maybe that helps to have kind of a perspective in mind that, in a month, this isn't going to end. Like we're in this for a little longer term. So I think this comes to another question. We've had a few people, Heather, that I can see her question here, talking a lot about mental health. Um, we've done a ton of articles from ThedaCare with one of our mental health clinicians about, mental health aspects related to COVID-19, the staying home, the not being as socially active, parents who are trying to homeschool and work from home. That's really difficult for some people. Dr. Baeseman, you are a family medicine physician as well. Tell us just a little bit about, how mental health is impacted by this pandemic, and maybe some really simple suggestions or ideas that we should all be keeping in the back of our mind just to maybe keep a check on our mental health.
Mhm. Oh, that's a big question.
I know.
It's huge, and it really is impacting people profoundly, to say the least. The whole aspect of our mental health. We are social beings. Humans need social interaction. That's part of our wellness. Before the pandemic, I would talk to people who are retiring and saying, this is one of the most dangerous points of your life, because your whole social structure of whatever your work environment is now transitioning to this retirement life, and you need a plan for how you're going to stay connected to people. That was before the pandemic. Now we have this pandemic, and it's critical to stay connected to people. I would say a couple different thoughts. If you're feeling blue, if you're feeling down, if you're feeling not good about your current mental health, be vulnerable, take that risk, and lean into some of the people that you have in your circle of support, or your primary care doc, or a counselor. That's normal. That's normal for what we are grieving as a society with what we are being asked to do. And we didn't ask for this. It's been given to us. It's what we have to deal with. So having a plan around that, being vulnerable, leaning in to those that can help support you, and you'll find that it's both ways. The people that help support you will also be people that are asking for your support when they're going through a wave that isn't feeling good to them mental health wise. Exercise is critical. Get off the phones, get off the TV, get off of Netflix, get out in the woods, get out in someplace quiet, get some exercise. There's this whole concept before the pandemic called nature deficit disorder. We had to name this because it's such a problem in our society, of people not getting connectedness to what is actually real, not the virtual stuff. So get yourself out to a quiet space that you like. Try to get some exercise regularly, get that into your schedule. Another aspect of this that's just critical is having a well-balanced and healthy media diet. So, and this waxes and wanes. We have an obligation to be informed, we can't walk through this life, especially with everything going on, not being informed. That's dangerous. But we also have an obligation not to consume this stuff 24/7 and allow us to really get trapped into this not so positive situation with all of the really historic things happening around us all the time. So, generally speaking, when I'm not doing well with my media consumption, I lighten it up. And one of the ways that I lighten it up is a 15-minute podcast that gives me just high level, what do you have to know to be a person in this world, especially living in the US. And there are a number of different ways that you can do that, but really start to monitor your media consumption. Monitor your time with your phone, monitor your time watching the news, and make sure that you have a really good balance. Because usually when people are starting to feel not so good mental health wise, there's probably some balance things that are not going so well either. And having insight into that yourself is the first step. That's not always easy. And having other people that you can rely on to keep each other accountable. It's not uncommon that my wife says, all right, get off of Facebook, you're doing it too much now. And and I appreciate that so much, because sometimes you don't have insight into that. And yeah, you're right, I'm going to put the phone down. I'm not even going to carry it with me. I'm going to go spend some time with my kids outside doing something enriching for the people in my lives, instead of being consumed by a device that lives in my pocket.
That's really great that you mentioned that, of having insight on yourself. One thing that I've noted that has helped is your weekly screen habits, and it tells you the amount of time that you spend on your phone. I feel like that's really eye-opening when you say, wow, I spent that much time on my phone this week. All right, this week I have a goal of not to use it nearly as much. So like you said, just knowing that information is really important as well. Again, lots of comments coming in. We're trying to get to everyone. Please continue these comments. This is exactly the type of conversation that we're looking for. Dr. Baeseman, Dave would like to know if you're concerned, or if you've heard concerns about lifting that safer at home order. Again, it was supposed to be until a certain amount of time, and then was, brought back a little bit. Are there any concerns about lifting those orders?
Yeah, I mean, there's tremendous concern about lifting those orders. And I want to be sensitive to the economic crisis that we are facing because of this. That's real too. And there are going to be lives potentially lost connected to the economic crisis as well. So we do have to strike a balance of both. But the way that it went about was probably the worst possible way that it could have happened. So to have the Supreme Court undo it without any grace period for anybody to prepare or have a different kind of plan sent the wrong message to the population that this was over, and it wasn't. It was a legal thing that was overruled. It wasn't that the seriousness of the pandemic was any less. And so I think people got kind of the wrong impression that if this isn't going to hold up legally, therefore, my government would never put me at risk for my health. Why would I not be able to go back to normal? And that's a narrative that I see commonly. And it just, in an ideal world, we would have been talking to start with, and we would have had a plan with all of our representatives in government. And that's not the reality of where we are right now as a country. And that's unfortunate. But as citizens in our local communities, we have to get past these other narratives. We have to work together. There's just no other way. We are absolutely unequivocally connected together in all of this stuff. And as we all work together to get through this, we will all do better. I promise you that.
Absolutely. We have some questions coming in now about children, which I think really good topic for us to tackle here. Tina wants to know, she's seen a lot of children going back into stores. What are the recommendations for children wearing masks? I believe the CDC says no children under 2 years old should have anything obstructing their face, but older children, I have a 2-year-old and he has a mask, and it's sometimes hit or miss. He knows that he's supposed to wear that mask, but what are those recommendations for children as they are maybe venturing out more with parents? Who should be wearing a mask?
If your kid is old enough to be wearing a mask, and can keep a mask on, I think that's a good idea. For anyone to even seems kind of young. For a lot of 2-year-olds, I think it would be an incredible task to ask them to keep a mask on. And so I would say the bigger strategy is, if you can't, trying your best not to have children in public spaces where they're, grocery stores, those kinds of things. Now, for some people, it's not an option. I might be the only parent right now that's taking care of my child, and I have to go to the store, and I obviously can't leave my kid in the car. So if there isn't some other way I can partner with a friend, like you can watch my kids right now, I'll watch your kids, or I'll get groceries for both of us. I mean, there's ways that you can pool your risk so that it is potentially less in a smart way, making good decisions. But generally speaking, kids are one of our populations, along with pregnant women, that are more likely to be asymptomatic and be able to spread the disease. So those are the people that really ultimately are a huge vector for this as a population and community spread. And they aren't going to be able to tell you because they're a kid, and they may not even have symptoms, which, so the fact that they didn't have symptoms is not really reliable either. So that's a tough
Okay.
one.
Yeah, it is. Keeping on the topic of children, Callie wants to know, why don't we see more child cases of COVID-19? And maybe that sort of goes back to your statement before about that kids, we're seeing more asymptomatic and also just really can't tell us the symptoms or what they might be feeling. But why is that we just don't see more kids with positive cases?
Mhm. You know, it's a good question, and it has everything to do with a kid's immune system and an adult's immune system and everything else in between that we don't understand about this virus at this point. Um, I would say, from a perspective of this virus being different than other viruses that we have seen before, like SARS, there was a big, and MERS, these are all COVID coronavirus-like viruses. In the past, there really hasn't been this asymptomatic component, so that's really something new. And from the virus's perspective, there's probably some advantage to be able to spread this asymptomatically from the virus's perspective. This virus wants to replicate. That's the only thing that it does. But as far as why some kids don't have as many symptoms and pregnant women don't have as many symptoms, I don't know. But the good thing with that is that they also have less severe disease. So we're not seeing the mortality in children and pregnant women like we are in the past with things like H1N1. H1N1 was devastating for the healthiest people because their immune response was so rigorous that became the problem. So, it's part of just being a different kind of virus and trying to sort out, what we know about it. But the why, we probably won't know for quite some time.
Okay. We sort of hit on this topic a little bit, but I think it sort of goes back to the misinformation that you might be hearing in your community specifically. I know you said once the safer at home order was lifted, it was like things just sort of went back to normal. And that's not what we're seeing numbers wise or anything like that. So I think you said that, bars were open back up. You saw everybody, heard about people there with no masks or social distancing. What do you want people to know who may feel that because safer at home was lifted, that things are going back to normal?
What do people need to know now as far as, I don't quite, can you rephrase that one more time?
Well, do you think that, are we going back to normal? I think maybe with safer at home being lifted, people feel like that now. Should they?
I think a lot of people feel that way. And when you are around like-minded people that are also feeling that way, it's easy to start to have this confirmation bias and believe that that is the case. And I got to tell you, there's been a number of times where I've felt like, a weekend at home, things feel normal. Gosh, it's easy to just pretend that they are. And sometimes, that's an okay defense mechanism if you're in a safe spot and you're not out in public and doing all those things. But it's just not the reality of it. And it's going to cause a bigger issue for us. It's going to cause more economic damages for businesses when we eventually have to deal with our surge that is on its way sooner or later. And it's really, you're going to start to see more of these community outbreaks. And we've had one in Wapaka last week. That's the first one. And that was in a situation that was thought to be highly controlled. So if this is happening in places that we are trying to really have a tight reins because it's a vulnerable population or something along those lines, I mean, all it takes is for, one person that's infected to be in a really big public gathering, and now all those people go out to their families, and here we are, it's on. Our community is surging, and it's quick. It can happen quick.
Okay, good to know. Anne would like to know, can you test positive for strep and COVID at the same time?
So with tests, there's two different ways to measure how good a test is. There's how good is it picking up actual disease states, and there's a percentage that it will pick up and a percentage that it won't, and how good is it at ruling out negative disease states. And so there is some crossover with some different lab tests as well. So is it possible to get both? Sure, but it comes down to the details of how sensitive and specific both those tests are. And I would imagine if you have strep and COVID positive at the same time, there's a reasonable chance that one of them is a false positive. But it could happen theoretically. And I would expect if it were positive, people who have bacterial infections on top of a viral infection, that's like kind of a worst case scenario for mortality, to be honest. That's the way that influenza kills the most people. It's when they get secondary infections on top of it. And when you have an illness that lasts for a week or 2 weeks, there's more chance for that to happen, especially if someone is ill and they aren't clearing their secretions very well. And that is also true for COVID. So people who get bacterial infections on top of that, it is definitely more dangerous.
Okay. Debbie would like to know, going back to the topic of children, should we be concerned about that anti-inflammatory disease that is showing up in some children who have tested positive?
It's unfortunately fascinating, curious, academic, which is not what most people are probably concerned about. This is a really bizarre thing, and we know that it is happening. There's two different things in kids that are happening that potentially are a mechanism for mortality. One of them is this thing called Kawasaki disease, which is very hard to diagnose. It usually gets diagnosed in multiple visits because it's kind of a presentation that evolves. So it's very challenging. Clinicians are reviewing all those kinds of things because it's not something that some clinicians will even see in their lifetime normally. And then the other one is this inflammatory state that kids are getting. The good thing is that it's a very, very, very small subset of kids that are experiencing either of those things, much less than adults as far as mortality is concerned. But it is a critical thing to recognize them when they're happening. And that's why your primary care doc is a really valuable resource. That's why our triage number is a really valuable resource. You can always call, and we want you to call. If you're concerned that your kid might have COVID because they aren't, something's not right, and you're not sure what's going on, or if it's clear that they have a respiratory infection, please call. Please call. We'll work through our triage protocol. We developed all of these, by the way. This is part of what we were doing during our downtime as we shut down and had the stay-at-home order. None of this stuff existed before. So, this has all been developed to keep you safe, to get you information, and to be a reliable resource in our community, so that we can get through this together.
I think that's important to know too. Again, as we just continue these conversations, what do you do if you think you may have COVID or a family member may have COVID? Like what are those steps? What does that look like?
First step is giving us a call. We don't want you coming to the ER. If you're sick, please, by all means. I mean, if you feel there's potentially a life-threatening event happening, by all means, that's what the emergency department is for. But we want to be mindful to not have a lot of additional respiratory cases in the ERs that don't need to be there, because specifically there are other people having heart attacks, having strokes, having traumas that need to get addressed that don't have COVID, and we really want to be smart about using our resources wisely. So please call if you are not having a life-threatening event, and the nurse triage can help point you in a direction, whether you need to watch this, what you need to watch for, whether you need to come in, when you would need to come in if you do. And we have respiratory hubs that have been developed around our whole system, so that we are keeping people who are potentially infected away from the people that are more vulnerable, that have essential cares that they need to have happen. We've redesigned some of our clinics actually to help facilitate this, so that we can keep people separate, so that we can sterilize things better, to be more effective in getting you the treatment that you need. And then your primary care doc is also a super valuable resource. I mean, for anyone who is a ThedaCare patient and does not have MyChart, it is definitely worth your time to get onto MyChart. And now we have this additional app called Ripple, which really connects all of your healthcare resources in one little spot. So the technology, which has all been innovated literally in this time as well. I mean, we have video visits that are live, and we're constantly improving them as well, but they're to a point now where they're really quite good. I mean, they're a really good substitute for any kind of visit that does not require specifically some kind of physical exam. And they can be coordinated with labs. So for chronic disease management, diabetes, heart disease, cholesterol, blood pressure, all that kind of stuff, we're really trying to find a way to get the care to you that you need. But we also have sites that are designated to safely bring in vulnerable folks that just need to see their doc. And especially with some of the mental health stuff, your primary care doc may be a super valuable resource for you.
Absolutely. I'm glad that you brought that up too about, keeping patients who may have COVID concerns separate from the population that may not. This brings us back to the topic of children and getting their vaccinations on time and keeping them on their schedule, coming in for well visits. Again, we just had an article written this week about why it's so important to keep those wellness visits, especially for kids, and getting their vaccinations on time. Can you talk a little bit about that and why it's so important to continue that with your primary care provider or your pediatrician?
Yeah, it's super important. And my perspective on this is a little bit of a public health catastrophe kind of perspective. When you have a major catastrophe of any kind, it's never one thing that goes wrong. It's always one thing that leads to a fail-safe that didn't work, that leads to something else, that leads to something else. So here we are in a pandemic, and people have been forced to defer their cares while we had to stay at home. But the last thing that we want is to cause an additional problem by not addressing the normal stuff that we have to address. So for children, the CDC has rigorously studied the whole vaccination schedule. There are a number of shots for each disease of vaccination that we have. They're on a specific schedule to best protect those children at the times they will be most vulnerable and to be able to get them lifelong immunity. So we don't want to be deferring that stuff. That stuff is really essential. It is really important to stay on your schedule. And there's lots of ways that we can get you access to that care safely. And that goes for other, chronic disease stuff as well. Diabetes is a big risk factor for COVID, so is obesity. So, there's some essential cares to make sure that those things are well controlled. It can't just be deferred for, an unknown period of time. So.
Good to know. I've seen a lot of comments on here asking about antibody testing. There's a few different thoughts around antibody testing. I know that you have heard a little misinformation in your community that says, oh yeah, I had antibody testing, I showed up positive, I'm good, I can't catch this again. But we really don't want antibody testing to be serving as that kind of false sense of security, right?
Mm-hmm. Yeah, absolutely. And we don't know what it means yet either. I mean, that's kind of like the real kicker. So I have a positive test. What does that mean? I don't know. You've had an exposure. I mean, I know that probably, relatively certainly, but that's not even a guarantee. It could have been some other coronavirus that caused the antibodies to be positive, which they're.
We're sort of ending our time here. We're going to try to answer as many questions as we can. Please keep them coming in even after the Facebook Live ends. We'll try to help answer or steer people in the right direction to get good, reliable information. Maybe we will send some of those questions over to Dr. Baeseman that he can answer as well. Dr. Baeseman, as we wrap up here, what thoughts do you want to leave people with? What do you want people to know at this point? We're sort of like 5 to 6 months into this journey. What do you want people to know?
I would say one thing is, lean on other people, be vulnerable. If you're not sure, ask. If you want more information, or you should always be questioning what you know. That's one of the things that's so important, is to not hold any piece of information as if it is the absolute truth, and constantly reevaluate whether you have the right piece of information to be protecting yourself, your family, your community as well. And this is changing quickly. So having a few really reliable resources is better than having many resources that are potentially unreliable. So pick your resources that are reliable, that get you regular information. And I would say on the top of that list should be your local healthcare organization. They're doing this work. They have every invested interest to protect their employees who are on the front lines, and they have every invested interest in protecting their community. So I would say that's a highly reliable source of information, as well as the Department of Health and Human Services and generally CDC as well. One final comment I just want to leave you with here is just something that I was thinking about with one of the other pieces of misinformation I've gotten, was with vaccinations. And so many people want to compare COVID-19 to influenza. And part of the thing about that is that influenza and COVID-19 are two different species. I mean, we talk about viruses, they're both viruses, but they're different species. They're very, very different. And so it's the equivalent of saying, I had a dog as a kid, therefore I have a pretty good idea of how your cat's probably going to behave because of my experience with my dog. That the similarities stop when they're mammals, after that, just the same as with this. So please don't infer information based on what you believe you know about influenza. Get good information, and stay abreast of the new information as it's changing, because this is new stuff. The science is working alongside of us to help keep people protected to get to the other side of this.
Wonderful. All right, Dr. Baeseman, we're going to end it there. Thank you for your time today. Again, we appreciate everybody leaving their comments. Continue to leave those, and we'll get to answer as many as we possibly can. Thanks so much.
Thanks for the great discussion. Have a great day.